Welcome to the latest episode of Prostate Choices Zoomcast. I am your host, Shelley Gordon. COVID cases are on the rise and hospital emergency rooms and ICUs are nearing capacity. We know that this is creating a challenge for hospitals that are putting off elective surgeries. I am joined today by Mark Oczachowski. He is the chairman and CEO of EDAP TMS. EDAP is the company behind the medical device used for a procedure for men called high intensity focused ultrasound, or HIFU. I'm also joined by Dr. Brian Miles. He is the vice chair of the Department of Urology at Houston Methodist Hospital. Dr. Miles is also professor of urology at Weill Cornell. And next to me is Dr. David Silver. He is the director of the Division of Urology and chief of urologic oncology at Maimonides Medical Center in Brooklyn. Mark, let's start with you. What are you hearing from hospital administrators and urologists about dealing with COVID? And can you elaborate on how men with prostate disease can be treated during this pandemic?
Yes, the pandemic is certainly creating major issues for hospitals around the world. Men with prostate disease are at great risk. Treatment is delayed because healthcare resources are being pulled into COVID care. Delaying treatment for prostate disease could create other issues, comorbidity that worsens their conditions, increases pain, and many other complications. For patients with prostate disease, our technology is non-invasive, quick, and a true outpatient procedure under a light anesthesia where the patient goes home the same day. Some of the hospitals even perform HIFU under spinal anesthesia with the patient awake. Out of the tens of thousands of procedures done around the world, no patient has ever required post-HIFU ICU care to the best of our knowledge. In fact, men who are having HIFU are safely located and isolated from COVID patients and not at any risk of being exposed to the virus. In this time of COVID, where hospital resources are stretched thin, HIFU is the ideal solution for patients with prostate conditions who are being forced to delay treatment. Because they risk having their condition worsen, possibly requiring more complicated and expensive treatments down the road with a hard hit to their quality of life. Whereas HIFU does not take a lot of OR times or resources, it can even be performed in a smaller setting. Our Focal One device is today's most advanced device to use to ablate diseased prostate tissue. The procedure takes from several minutes to 1.5 to 2 hours, and the patient is discharged and sent home shortly thereafter. Because the ablation is so precise and the urologist knows exactly where to aim and focus the HIFU energy, he can target and destroy only the diseased portion of the prostate, leaving the healthy portion intact. This approach reduces the risk of common side effects often associated with surgery and radiation of prostate, including urinary incontinence and erectile dysfunction. Not only does the hospital not have to delay this procedure, but the patient gets to preserve his quality of life. While all eyes are on COVID, EDAP has a cost-effective solution that makes it possible to continue elective procedure for patients with prostate disease. There is no need to delay and put patients at further risk. Again, and to make a long story short, there is clearly an issue in today's context to perform surgical procedure of prostate. EDAP with Focal One has a concrete and effective solution, and it's available now.
Thank you, Mark. So Dr. Miles, let's turn to you. First of all, tell us, how long have you been performing HIFU? I think you've been performing longer than some of the other doctors. And what results are you seeing? And also tell us how you're dealing with your prostate cancer patients during the pandemic.
Thank you, Shelley. Thanks for the opportunity to speak on this subject. I've been using HIFU for a long time. I first used it in 1998 when University of California, San Francisco, Georgetown, and at Baylor, where I was, we had a HIFU machine, the Ablatherm, which we were using in men with radiation failure. This was an attempt to get the device approved by the FDA. The trial was difficult because of requirements by the FDA, so we weren't able to complete it. but I was very impressed with the technology, the results that we had in the 20 odd patients that I treated then. And I knew that if it ever got approved, I wanted it. And it did get approved in 2016. I convinced my institution to buy an Ablatherm, and we treated quite a few patients between a colleague of mine out in West Houston and myself. And then when the Focal One came out, I immediately purchased that. In total, I've treated more than 100 patients with HIFU. I love the technology. I love the flexibility it gives me. I compare it to, or the ability with the Focal One to doing a lumpectomy in women, because I can use it to treat very small areas of the prostate. I can treat the whole prostate or just half of the prostate. So it's very flexible. The reason that that's helpful is I can protect men's urinary control and their erectile function better if I don't treat the whole prostate. With surgery and radiation, we're pretty much limited to treating the whole gland. With HIFU, I don't have to do that. Again, I can treat a small area, a lump, if you will, just like breast cancer. Risk of impotence and incontinence is really quite low, and I'm very pleased with that. As far as doing the procedure in this terrible year of the COVID, it's an outpatient procedure. Patients have embraced it very well. They have cancer. They know there's a risk of COVID. They'd rather deal with the cancer, and trust that we will do everything in our power to protect them from the virus, which we do. Every patient is tested before they come to the hospital, 48 hours before. This is to protect the staff when patients are put to sleep. They are isolated from anyone who does have the virus, which is in a far remote area of the hospital. And family members are not allowed in the hospital. They're allowed to pick them up. So we limit the number of visitors, again, trying to minimize the exposure from the community of patients within the hospital. And so far, that has worked out very well. Patients have been pleased, and so have I. It's a technology I embrace and will continue to use, and look forward to gaining more experience for the benefit of my patients. Thank you for the opportunity to speak on this.
Thank you, Dr. Miles. Dr. Silver, tell us what it's been like for you at Maimonides. Are you seeing a surge in hospitalizations of COVID patients? And are you treating your prostate cancer patients?
Well, thank you, Shelley. As you probably know, we were in Brooklyn at the very center of the first wave of COVID some months ago, and all beds in the hospital were converted to ICU beds. We curtailed all elective procedures at the request of the state, and it was really all hands on deck to take care of these COVID patients. All my urologists were repurposed as ICU doctors during this time. But once the state lifted the restrictions and we started doing elective procedures again, we initially started with the high-risk patients, and then it opened up to the intermediate and then to the lower-risk patients. And now, we've pretty much returned back to normal operations.
So what is the process now for elective surgeries and HIFU?
Well, similar to Dr. Miles' approach at his institution, we have separate streams for the COVID and non-COVID patients. COVID patients generally enter through the hospital's emergency department or through the outpatient clinics. They're rapidly tested, and then they're sent up in isolated elevators to a special ward walled off from the general hospital population. For the non-COVID patients, many of them never see the inside of the hospital. We often do the initial evaluations via telehealth. They'll come in at the same time as pre-testing for a brief examination. And then on the day of the surgery, they go to an ambulatory non-COVID area of the hospital, completely separate from the main center. And because it's outpatient, they're really only there for a few hours before they leave. So we've really separated the COVID from the non-COVID patients.
And how are the patients feeling about doing the HIFU procedure right now?
Well, what everybody seems to be looking for is to minimize their exposure to the healthcare system or to anybody outside their own COVID bubble. So HIFU is especially attractive to these patients because it's done quickly in a single session, really with minimal exposure. Unlike radiotherapy, where the patient comes in multiple times during the week, or surgery, where there's exposure to the main hospital, to multiple personnel and instrumentation. It's really a drive-by procedure at this point. And people like the ability to get in and out. It's increased tremendously in popularity because of that. People are asking for it because they've heard they can get this done and go home.
So how does HIFU differ from the other procedures that you've done, surgery and, well, radiation would be another clinic, but tell us how it's different.
So as Dr. Miles mentioned, there's really been a change in the way we conceptualize the treatment of prostate cancer. If you think about it, there's no other cancer that's treated the way prostate cancer has been traditionally. Usually, if somebody has, say, a small colon tumor, you wouldn't take out a whole colon. As he mentioned, for breast cancer, we'd be thrown out of the hospital if we removed the whole breast for breast cancer. You just wouldn't think of treating an entire organ when there's a small tumor in only one location. And so it's sort of an historical anomaly that we remove the entire prostate or irradiate the entire prostate for a prostate cancer that's located in only one location. And this is because prior to focal therapies, we really didn't have any way to do this. So now with focal therapies, we can treat only the tumor and leave the rest of the prostate alone. And as Dr. Miles mentioned, it decreases the risk of the loss of urinary control, the loss of sexual dysfunction. HIFU is absolutely non-invasive. It's outpatient. It's a one-shot procedure. It can be repeated if necessary. And you would expect that with this approach, it could minimize the side effects. And that turns out to be absolutely true. It definitely has less side effects than a total ablation or surgery or radiotherapy.
Thank you. That was great. Thank you, Dr. Silver. So thank you all. Again, I'd like to thank Mark Hoshikowski and Dr. Miles and Dr. Silver. We wish you and your patients and your family well. Thank you very much.
Thank you.
Thank you.